Hey everyone, this is our peer teaching project. My name is Siani Chotes.
And I'm Maya Crockham.
And I'm Jennifer Kritzelis.
So basically, this project focuses on addressing the Healthy People 2030 objective NWS-01, which aims to reduce household food insecurity and hunger. Using the SBAR format, we will present a nurse-led initiative designed to improve access to nutritious food and support individuals and families struggling with food insecurity. The objective is to highlight how nurses can play a pivotal role not only in clinical care, but also in public health through education, advocacy, and community engagement. Our nurse led teaching initiative aims to create long term, sustainable solutions to food insecurity in the community. By identifying gaps in food access and educating individuals about the importance of nutrition, we can help empower them to make healthier choices. The SBAR format will guide our planning, ensuring the initiative is clear, structured, and actionable. This project underscores the importance of community engagement and collaboration, key elements in creating effective, long lasting change. As future nurses, we understand that tackling food insecurity requires ongoing efforts rooted in trust building and education. Through this project, we aim to connect individuals with local food resources, raise awareness about nutrition, and advocate for systemic changes that address the root causes of hunger. By taking this proactive approach, we hope to improve both food security and overall health outcomes in Upper Marion Township. Today, I want to highlight an important public health goal from the People 2030 Initiative, Objective NWS-01, which overall aims to reduce household food insecurity and hunger. The goal here is to ensure that more individuals and families have consistent access to enough nutritious food. Unfortunately, instead of improving, this objective is currently classified as declining. That means more households are now facing food insecurity than before, and this is especially concerning for vulnerable groups like children, older adults who face the greatest health risk when proper nutrition is lacking. We're not just talking about a national issue. It's something that's hitting close to home. In Upper Marion, right here in Montgomery County, Pennsylvania, we're seeing a clear reflection of this trend. Local food assistance programs like Upper Marion Area Community Cupboard or UMACC are now helping around 160 families every single week, providing essentials like fresh produce, dairy, meat, and personal care items. That's a significant increase in demand and it aligns with a wider regional pattern. In fact, in 2023 alone, Montgomery County saw a 60% increase in visits to food pantries. Several factors are contributing to this growing crisis, including inflation, rising housing and grocery costs, and cuts to some government support groups. The Montgomery County Food Council even referred to the situation as a growing food insecurity crisis. So, what can we do? To truly address this issue, our communities need more than short term solutions. We need to strengthen local food programs, raise public awareness, and invest in long term strategies that get to the root causes like poverty, affordability, and even access to healthy foods. This is a public health challenge that affects not only individuals, but the well being and stability of entire communities. Addressing it starts with understanding it. And that's why discussions like this one are so important. As you can see in this image, food insecurity is clearly on the rise across the United States. This visual emphasizes the growing number of households struggling to access enough nutritious food, reflecting a troubling national trend that demands urgent attention. While Marion Township is often seen as one of the wealthiest areas in Montgomery County, this data challenges that perception by revealing a hidden reality. Food insecurity is a present and growing issue. According to the township's 2022 Community Needs Assessment, a significant number of residents are facing financial strain, with job loss and difficulty making ends meet being common issues. In fact, food insecurity ranked as the fifth most pressing concern among residents. The increase in demand at local food banks, serving over 1,100 individuals in just a single month, shows us that these needs exist even in communities that appear well off from the outside. This reminds us that food insecurity isn't always visible, and addressing it requires awareness and action, even in places where we might not expect it.
The Healthy People 2030 initiative has identified reducing household food insecurity and hunger as a leading health indicator due to its significant impact on public health. The background is food insecurity has and continues to affect millions of Americans, particularly children, older adults, and low-income families, and is associated with poor physical, emotional, and developmental outcomes. Lack of access to nutritious food increases the risk of chronic diseases, mental health issues, and a lower quality of life. Individuals facing food insecurity often experience economic instability, forcing them to choose between food and other necessities like housing or medical care. This stress can contribute to anxiety, depression, and reliance on unhealthy coping mechanisms. Physically, both short and long-term effects, such as hypoglycemia, obesity, heart disease, and diabetes, are common due to reliance on cheap, low-nutrient foods. Addressing food insecurity is essential for improving health equity, reducing healthcare costs, and supporting resilient communities. In this picture, you see this is how food insecurity impacts our health. Inadequate intake of nutrition, and it can make you an increased risk for various chronic diseases, for negative pregnancy outcomes, long-term deficits in children, socio-emotional, cognitive, and motor functioning. Increased risk for negative mental health impacts, including depression, suicide, substance misuse, etc. Total healthcare costs increase steadily with increased severity of household food insecurity. The American Heart Association highlights both the mental and physical health risks linked to food insecurity. Economic hardship forces many to make impossible choices, contributing to stress, anxiety, and depression. Chronic stress may lead to unhealthy coping mechanisms such as smoking or alcohol use, increasing the risk for further health issues. Physically, short-term hunger can cause fatigue, dizziness, and irregular heart rates due to hypoglycemia. Over time, ongoing food insecurity contributes to obesity, heart disease, hypertension, diabetes, and stroke, largely due to the reliance on inexpensive, nutrient-poor food options. These outcomes only diminish individual well-being, but also lead to higher healthcare costs nationwide.
So now we'll discuss the assessment portion of our SBAR, highlighting the objective of household food insecurity and hunger. The Healthy People 2030 initiative includes this key goal, which aims to reduce the national household food insecurity rate from 11.1% in 2018 to just 6% by the year of 2030. However, we've seen an unfortunate reversal. As of 2022, 12.8% of households were experiencing food insecurity. This uptick was not random. It's shaped by a combination of economic disparities, systemic inequalities, and policy shifts. For example, even with climbing grocery store prices, there has been a rollback of pandemic-era SNAP benefits, which has significantly impacted many vulnerable households, leading to rising food insecurity. Beyond policy, structural issues like food deserts, inflation, and limited access to affordable nutrient foods continues to exacerbate food insecurity, especially in historically marginalized communities. It's also important to recognize how intersecting factors like low income, transportation barriers, and access to resources can leave families and individuals unable to consistently secure the food that they need. So let's take a look at Upper Marion Township. With a poverty rate of only 4.2%, it might not be the first place that comes to mind when we think of food insecurity. Yet, Upper Marion area Community Cupboard, the local food pantry, serves approximately 160 families every single week. This clearly highlights the reality of hidden poverty, where income alone doesn't fully capture people's needs. Rising food costs, housing expenses, and transportation limitations all contribute to the insecurity, even in wealthier areas. In Upper Marion, access to food often depends on reliable transportation. Many residents must travel via busy highways or rely on limited public transit just to get to a grocery store. And many of these stores cater to high income consumers, making affordability another barrier. While the local food pantry has promoted delivery services, signups have been closed due to an overwhelming demand. This leaves many residents, particularly those who are disabled, on a fixed income, or without transportation, struggling to access support. Food insecurity is deeply multifaceted. Yes, it's about income, inflation, and transportation, but it's also about the changing availability of support programs. For instance, the ongoing discussions about reductions of federal and state funding for SNAP could leave even more families without help. Here is a recent news clip discussing how this might impact communities within the state of Pennsylvania.
Schools and local food banks bracing for the future. They're concerned about the trickle-down effect of federal funding cuts.
That includes more than $1 billion earmarked for farmers to provide food to the organizations.
Our Tristan Kleinfelter takes a deeper dive into how it could affect our communities.
Schools and local food banks are concerned about the U.S. Agriculture Department's recent cuts in funding to two programs, the Local Food for Schools Cooperative Agreements and the Local Food Purchase Assistance Cooperative Agreements.
Those are going to impact school feeding programs. So there's going to possibly be more families that need assistance in our community.
And they're not alone.
The $500 million plus cut to the food banks is also very worrisome.
The State College Food Bank works with the Central Pennsylvania Food Bank to buy in bulk with cheaper prices.
Seeing these cuts, and then if other fellow nonprofits are losing programs and their staff are having to be cut, we are anticipating more need growth. So from some of those cuts, we're going to see more people coming, but also some of those cuts are going to cause our food costs to go up.
Beck says they have not been directly impacted by the cuts so far, but are preparing for what could happen.
Thankfully, at this point, we haven't had to change what we have available and how we're distributing food, but that will become a question for us if we need to start prioritizing which items we have funds to purchase, depending on the cost.
Beck says egg prices are an example. At one point, they were paying over $6 for a dozen when it used to be $2. While the price hike isn't from the cuts, it does impact how much they can bring in, and stripping funding can contribute to the issue. She says while they can't control what happens, there is something they can do.
I don't have a lot of control over what's happening in Washington, D.C., but I do have a lot of control over what's happening here at the food bank and in our community. And the best thing we can do is help and support each other and make sure that those people and our neighbors around us are being taken care of.
Beck also had a message for the residents that depend on the organization. She says no matter what happens, they will ensure everyone gets what they need. In Centre County, Tristan Kleinfelter, WTAJ News.
Schools and
With that being said, what can we do as nurses? This slide focuses on a nurse-led activity that directly addresses the Healthy People 2030 objective, which ultimately aims to reduce household food insecurity and hunger. Although communities like Upper Marion Township, Pennsylvania, are often perceived as wealthy, food insecurity remains a hidden issue affecting many families. As nurses, we are in a unique position to tackle this challenge head on by incorporating social detriments of health screenings during patient admissions. By identifying families who are experiencing food insecurity or at high risk, we can intervene early, providing vital connections to resources like SNAP, WIC, and even local food pantries. This proactive approach is essential because it allows us to address the issue before it leads to serious health consequences, reducing the need for more intensive interventions later on. Studies have shown that food insecurity screenings within hospital workflows are not only feasible, but also highly effective, with over 60% of patients screened and actionable results identified. This reinforces the importance of integrating foods insecurity screenings into routine practice, as it gives nurses the ability to make a tangible impact on both individual health and broader community health outcomes. Furthermore, nurses are not just healthcare providers. We are advocates, educators, and connectors within the healthcare system. By using standardized SDOH screening tools, building trust through non judgmental communication, and collaborating with case managers and social workers, we ensure that patients and families receive the necessary support in a timely manner. This holistic approach to care for not only helps reduce insecurity, but also strengthens the overall health and well being of the community, directly contributing to the success of the Healthy People 2030 objective. As we continue to integrate these strategies into our practice, we can make a meaningful difference in the fight against hunger and improve the lives of those who need it most. This slide introduces a nurse-led community food security task force aimed at addressing food insecurity through a collaborative and coordinated approach. The task force would include nurses, social workers, food banks, schools, grocery stores, and community coordinators. Nurses play a crucial role by conducting assessments and screenings to identify at-risk individuals and families. This data then can be shared with the consent, of course, with the task force to guide targeted interventions. One key action is creating resource maps that highlight local food resources, such as food pantries, farmers markets, and WIC or SNAP offices, to ensure communities know where to access help if they need it. Nurses can also take the lead in advocating for policies that support food access, such as zoning laws that encourage urban gardening or mobile food markets. The American Nurses Association highlights that nurses as the public health advocates are uniquely positioned to influence policy and push for system-level changes. This approach emphasizes the powerful role nurses can play not only in direct care, but also in community advocacy and public health improvement.
To support the Healthy People 2030 objective, NWS 01, reduce household food insecurity and hunger, a nurse-led initiative could involve partnering with community centers, grocery stores, and local gardens to create food distribution programs for at-risk families. This secondary prevention strategy aims to prevent worsening health outcomes from poor nutrition. Nurses play a key role by identifying food insecure individuals during clinical interactions, advocating for resources, and leading community education and outreach, especially in areas like Upper Merion Township, where food insecurity may be less visible. Programs like the In-Store Coalition for Outreach and Coordination, IPOC, show success in improving access to nutritious food through health screenings, education, and support with WIC and SNAP enrollment. Implementation would involve forming partnerships, hosting events, and maintaining collaboration between healthcare providers and local businesses. Through leadership and advocacy, nurses link healthcare with community action to help reduce food insecurity before it leads to serious health issues. Food insecurity is a significant issue affecting millions of families across the country. In this nurse-led initiative, we would partner with local grocery stores and pharmacies to host health and food access events. This primary goal of this initiative is to reduce the stigma that often accompanies food assistance. Many individuals avoid seeking help because they feel embarrassed or ashamed. By providing services in everyday places like grocery stores and pharmacies, we can make it easier for families to access the support they need without feeling judged. To bridge the gap between health services and food access, nurses will partner with grocery store chains such as Giant, Aldi, or Wegmans, and local pharmacies to host monthly healthy living days These events will provide basic health checks like blood pressure and blood glucose testing. Nurses alongside dietitians will be available to offer personalized advice to help families make healthier food choices within their budget. Nurses will guide participants through enrolling in programs like WIC, SNAP, and local food vouchers. These events will provide essential health service and nutritional support all in one convenient location, making it easier for families to access the help they need. Nurses and dietitians will work together to provide practical tips on preparing nutritious meals with pantry staples. There could be live cooking demonstrations showing families how to create healthy, affordable meals using common ingredients found in food pantries or local grocery stores. Offering families easy-to-follow recipes that utilize pantry staples, teaching them how to prepare balanced meals based on a budget. These educational efforts will empower families with the knowledge they need to improve their nutrition, regardless of their financial situation. To encourage families to engage in these events, the participating grocery stores and pharmacies can provide incentives, such as discounts or gift cards, offering small discounts or gift cards to individuals who complete health screenings or enroll in food assistance programs. This initiative has several benefits, both for individuals and the broader community. Families will be connected with food assistance programs and learn how to make healthier food choices, improving their overall nutrition. Health screenings and nutritional counseling can help identify potential health risks early and prevent the development of chronic diseases. By providing education and resources, this initiative empowers families to take control of their health and food security.
Our last example initiative highlights how nurses, using a tertiary prevention approach, can make significant impact by conducting home wellness checks for high-risk families already facing food insecurity. As we know, tertiary prevention involves managing and mitigating the effects of existing health problems. In the context of food insecurity, this means nurses step in not only as caregivers, but also as case managers. Through home visits, we can assess the family's overall health, evaluate how well certain interventions like food assistance programs are working, and determine if new strategies are needed. These visits are far more than a simple check-in. Nurses use clinical judgment to monitor for warning signs of worsening conditions like malnutrition, unmanaged chronic illness, or mental health challenges related to food insecurity. Just as importantly, we can collaborate with social workers, local agencies, and community partners to make sure families are receiving consistent, coordinated care. This leads us to the nurse-led home wellness and nutrition monitoring program, which is the initiative model designed to offer personalized in-home support to families most affected by food insecurity. The program has a clear objective to conduct regular home visits for high-risk households in order to monitor long-term health effects and deliver tailored interventions. So here's how it works. During each home visit, nurses would evaluate physical health indicators like weight, vital signs, and chronic condition management. We'd also assess nutritional status, including food availability, meal routines, and even access to basic cooking tools. Finally, we'd review the family's participation in assistance programs like SNAP, WIC, or Meals on Wheels. Once these assessments are complete, the nurse can work with the family to build a customized care plan. This would include things like meal prep education based on what resources the family actually has, referrals to nutritionists or dietitians for more specialized guidance, and coordinated follow-up with primary care providers or social workers to manage any chronic or complex health needs. This approach ensures that interventions aren't one size fits all. Instead, they're rooted in the realities of each household situation, making them more practical and more sustainable. So why does this approach matter? Well, research backs it up. A study by Lee and their colleagues in 2023 found that nurse-led home-based nutrition interventions provided participants nutritional knowledge, behaviors, and better chronic disease outcomes. By being in the home, nurses gain unique insights, helping us provide culturally and contextually appropriate care that truly meets people where they are. Ultimately, programs like this one not only improve immediate health outcomes, but also create a foundation for long-term well-being. They address the ripple effects of food insecurity, from chronic illness to poor child development, helping to move the needle on national health goals like this one from Healthy People 2030. In closing, addressing food insecurity requires more than just food. It takes compassion, collaboration, and clinical insight. These recommendations presented are powerful ways to respond to the ongoing needs of vulnerable families. By continuing to support these types of personalized, community-based interventions, we can make real progress towards reducing household hunger and building healthier futures. Below are the resources for this presentation, and we thank you for listening.
Thank you.
Thank you.